Hi everybody. So today I'm going to be showing you how to shorten a penrose drain. So prior to the procedure, you're going to look at your doctor's orders to see how much of the drain that you are to shorten, what type of dressing will be required to cover that wound. Again, we want to make sure that we check our policy procedure manual, do good hand hygiene, ID our client, and we're going to use a sterile procedure. So in the beginning, I would have come into the room, remove the dressing, and I'm going to do an assessment of the wound. So here I'm going to assess the actual wound itself, plus the drain site as well. I'm going to be looking at location, what the incision light looks like, what the drain looks like, any signs and symptoms of infection, what the peri-wound skin looks like, the amount of drainage present on the old dressing, and the amount. I'm going to also ask my patient if they're having any pain, and I'm going to see if I can identify any foul odors coming from the wound. When I'm setting up my sterile tray, there's a few additional items that I have to make sure that I deposit on the tray. One of those items is a sponge, so a drain sponge, and then I'm also having to deposit a sterile safety pin. I'm also going to make sure that I have enough 2x2s and 4x4s so that I can clean the incision site as well as the drain. I'm also going to make sure that I have all the stuff that I require for my clean dressing afterwards. So just to save time here, I'm going to say that I've already cleaned the incision line, so that's going to be cleaned first because it's cleaner than the drain site. And then to clean the drain site, I'm going to take my moistened gauze that I've wrung out, and I'm basically going to start around the wound and make a circle. Then I'm going to go a little bit further around that drain in a circle. And then once more, work my way around the drain. Then I'm going to take my 2x2s, the dry ones, and I'm going to dry next to the drain, going around in a circle. A little bit further, going around in a circle. And then once more, going around in a circle. Once it's been clean and dried, I'm going to now shorten the drain. So the first thing I'm going to do is I'm going to pull up on my drain to the required amount. So whether it's 1 inch, 1/2 inch, 2 inches. And then once I've pulled up on that drain, the required amount, I'm going to insert the safety pin next to the skin and making sure I don't stab my patient with my safety pin. I can actually put that down. I'm going to then take my scissors and I'm going to cut between the 2 safety pins, like so, and then this can go into the garbage. Once that's complete, I can start dressing my wound. So for the drain, I'm going to point this downwards, like so, because if I were to point it in the other direction, it's going to leak up towards the incision line. The other drain sponge will go into the other direction. And then on top of that, I'm going to put an absorbent layer, and that will cover the drain area. To cover the wound area, I'm going to apply my non-adherent and then my absorbent layer. Again, at this point, I can grab my abdominal pad, open that up, and place it over top of the wound. And then all I need to do now is just take a piece of tape and tape around the edges. And that's how you shorten a penrose drain.